Hi, everyone. I'm Dr. Katherine Harris, an assistant professor of neurology in the epilepsy division at UTHealth McGovern Medical School in Houston, and part of the Texas Comprehensive Epilepsy Program. Today, we're going to talk about cannabis and epilepsy. This talk is really designed to be an introduction on this topic. There's a whole wealth of information that you could delve into. So the objectives for today are going to be to review cannabis-related terminology, discuss the history of cannabis as a medical treatment and important laws impacting its use, review the landmark clinical trial that led to an FDA-approved CBD or EPIDIOLEX for specific types of drug-resistant epilepsy, describe the side effects and drug-drug interactions of CBD, discuss main differences between some of the types of CBD on the market today. So first, you've got to be familiar with some of the terms that I'll be using through the rest of the talk. So cannabis is a scientific name for a certain type of plant with medicinal properties. One of the more common terms for this is marijuana, which is actually the dried leaves and flowers from the cannabis plant. Now, when marijuana is used for pleasure and relaxation, it's referred to as recreational marijuana. But when it's used to treat a disease or improve symptoms, it's referred to as medical marijuana. Medical cannabis is another term that essentially means medical marijuana. Cannabinoids are chemicals or molecules from within the cannabis plant, so it's a part of the plant. CBD or cannabidiol is a cannabinoid, so a chemical or a molecule from the plant that's being studied for seizure prevention. One of the key things to know about it is that it's not psychoactive. What that means is that it doesn't do the pleasure portion of what the whole plant does. It's just a part of the plant. So CBD doesn't have the potential to make you high. THC is a cannabinoid with psychoactive properties. So that's the part of the plant, the chemical or the molecule from within it that can create that pleasure sensation. Hemp is a type of cannabis, and historically it was used to make clothing fiber, among some other things. The flowers from it can be used to extract CBD, however. And one of the unique things about it is that it's not considered a Schedule I controlled substance because it has a very low THC content. Remember, THC is the part that can actually generate that pleasure component. So the legal status of cannabis is different from state to state. And this is a great graphic from the Epilepsy Foundation that illustrates some of the differences state to state. So all the states in green, that's where recreational cannabis for adults and medical cannabis is legal. The states in orange, medical cannabis is legal. The states in purple, only CBD, or the part of the cannabis plant that doesn't have psychoactive properties, that doesn't create the pleasure sensation. Only the CBD is legal. So Texas is one of those states where only CBD is legal. And for the rest of this talk, I'm going to focus a lot more on Texas, since that's where our epilepsy center is located. There are a couple of states that actually there's no legal use for cannabis. So it's important, whatever state you live in, to be familiar with the laws for that state because it does vary. So a brief history on this topic. Cannabis has been used medically for centuries. In 1937, the Marijuana Tax Act, the use and sale of cannabis was federally restricted for the first time. In 1970, with the Controlled Substances Act, this criminalized cannabis use and possession and limited cannabis research. In 1996, the Compassionate Use Act in California allowed California to become the first state to allow access and use of medical cannabis with a physician prescription. And there were many other states that followed after this. In 2015, the Texas Compassionate Use Act came about. This allowed physician prescription of a high CBD, low THC medical cannabis for refractory epilepsy treatment under the Texas Compassionate Use Program, also known as TCUP. So refractory epilepsy is when a patient hasn't responded well to the other FDA-approved medications. They've failed at least 2 other medications. A prescription, in this case, requires physicians to be registered with the Compassionate Use Registry of Texas, also known as CURT. Prescriptions are filled by licensed dispensaries in Texas and monitored by the Department of Public Safety. In 2018, the 2018 Farm Bill legalized hemp and hemp-based products, including CBD derived from hemp. Remember, hemp is a type of cannabis. Hemp was no longer classified as a Schedule I controlled substance, and this is because it has a very low THC content, and that's the part that causes the pleasure sensation. In 2018, the FDA approved EPIDIOLEX, which is a pharmaceutical grade CBD. It's over 98% CBD, and it was approved for specific types of drug-resistant epilepsy. CBD, the pharmaceutical grade version, called EPIDIOLEX, can be prescribed by any physician. So we're going to review some of the landmark studies that led to the approval of EPIDIOLEX by the FDA. In 2017, there was a randomized, double-blind, placebo-controlled trial. What you really need to know about that mouthful is that that's the gold standard within research to see if a drug is effective. So 120 children and young adults with Dravet syndrome resistant seizures were enrolled in the trial. The Dravet syndrome is an epilepsy that is very difficult to treat, and often patients do have drug-resistant seizures, and they've been on 2 or more medications, and maybe that's helped the seizures, but they're still having some. Half of the participants in the trial received CBD in addition to their usual anti-seizure medications for 14 weeks, and the other half received placebo in addition to their usual anti-seizure medication. 43% of the patients in the CBD group had their seizures decreased by 50% or more, while only 27% of the patients in the placebo group had seizures decreased by 50% or more. So there was a bigger improvement in the CBD group than the placebo group. There were some adverse events noted in the CBD group in this trial, including diarrhea, vomiting, fatigue and somnolence, fever, and abnormal liver function tests. In 2018, there was another randomized double-blind placebo-controlled trial. This time it was done in patients with drug-resistant lennoxgasto syndrome. So this is another type of epilepsy syndrome that is typically difficult to treat with medications. So all of these patients had been on 2 or more medications, and while that may have helped their seizures decrease in frequency, they were still having some. So half of the participants received CBD in addition to their usual anti-seizure medication for 14 weeks, and half received placebo. The median reduction in a specific kind of seizure called drop seizures in the CBD group was 43.9%, while in the placebo group, it was 17.2%, so a bigger improvement in the CBD group. Again, there were adverse events noted or side effects noted in the CBD group: diarrhea, vomiting, somnolence, fever, and decreased appetite. Another study in 2018 looked more at the dosing of the CBD. So again, it was a randomized double-blind placebo-controlled trial, and still looking at drug-resistant patients with Lennox-Gastaut syndrome. This time there were 3 groups. One group received CBD at a dose of 20 milligrams per kilogram per day. This was in addition to their usual anti-seizure medication, again for 14 weeks. The next group received CBD at a dose of 10 milligrams per kilogram per day, in addition to their usual medications. And then the last group received placebo with their usual medications. So the median reduction in drop seizures in the 20 milligram group was 41.9%, which was a little better than the 10 milligram CBD group at 37.2%, which was still better than the placebo group at 17.2%. Again, adverse events were noted in the CBD group: diarrhea, somnolence, decreased appetite, and 14 of the patients also had elevated liver enzymes. So the results of these trials led to the FDA approval of EPIDIOLEX. And this is the only FDA-approved CBD, and it's pharmaceutical grade, so it's the most pure stuff on the market. And those three landmark studies we discussed led to FDA approval for EPIDIOLEX, specifically for drug-resistant Dravet syndrome and lennoxgasto syndrome in 2018. There was an expansion of the approval in 2020 to include drug-resistant epilepsy due to tuberous sclerosis complex. It's approved for patients 1 year of age or older in these specific populations. This is a picture of what it looks like. It's a liquid and it's administered with a syringe. There are side effects and drug interactions of CBD products. So we've talked about some of the side effects already when we talked about what was seen in the trials. Sleepiness and sedation, diarrhea, decreased appetite, also insomnia. The elevated liver enzymes or liver injury. This tends to be more common in patients also taking valproic acid, which is another type of anti-seizure medication. And there are common medication interactions as well. Clobazam, another anti-seizure medication, can have its levels increase when it's taken with CBD. So the increase in the clobazam levels can increase the sedation. Valproic acid, we mentioned already that it's more common in patients that are taking valproic acid with CBD to have elevated liver enzymes or liver injury. There are also other anti-seizure medications that can interact with CBD: topiramate, rufinamide, eslicarbazepine, and zonisamide are some of those. And you should also note that there can be interactions with other non-epilepsy medications. So if you're taking any kind of CBD product, you should always discuss it with your doctors because they may want to check some additional blood work and make sure that your levels of medications are at the right level. They may want to check some blood work and make sure your liver is still working okay, those types of things. So they should be aware. Now, not all CBD products are created equal. There is commercial grade CBD. This is fairly readily available these days. It can be purchased online at a health food store, probably in a lot more places than just that. But it doesn't require a prescription. It's also not covered by insurance. One of the issues with this type of a product is that there's not enough consistency to it. So it's not regulated the same way that EPIDIOLEX is regulated. So the exact amount of CBD in the commercial grade products could vary. It could even change if you're buying it month to month, even if the product has the same label on it. And it might contain other things in it, other chemicals, bacteria, even mold has been reported. Labels also should be considered a form of advertising. They're not held to the same standards to be truthful or supported by testing when they're putting specific claims on their labels in terms of it will improve certain symptoms, for example. So you have to be a little cautious about that. There's also dispensary grade CBD. Now this is medical cannabis from a state dispensary, and it does require a prescription to obtain. Now, the dispensary grade CBD, the dispensaries have to follow state safety and testing guidelines, so it's more regulated than the commercial grade. The labels also have to be truthful and supported by testing and include the CBD level as well as the presence of other ingredients like THC. Unfortunately, it's not covered by insurance, and it tends to be quite expensive, actually. EPIDIOLEX is FDA-approved pharmaceutical-grade CBD, so it's the most pure stuff we have. It also requires a prescription. One of the advantages is that it has a much more uniform strength and consistent delivery because of the regulations around it. It's undergone controlled clinical trials, like the ones we talked about, in patients with specific types of drug-resistant epilepsy. It's covered by insurance typically for patients with the specific types of epilepsy that were investigated in the clinical trials. So lennox-gasto syndrome, Dravet syndrome, tuberous sclerosis. Sometimes insurance coverage could get approved off-label if there's a history of dispensary-grade CBD improving seizures for a specific patient, but that's not necessarily guaranteed. So when to ask your doctor about CBD? CBD might be considered if multiple other anti-seizure medications have failed to control seizures so far. This is especially the case in Dravet syndrome, lennox-gasto syndrome, or tuberous sclerosis complex. These are the specific types of epilepsies with the strongest evidence. These are the ones that were actually studied in the trials where the pharmaceutical grade CBD was used. So this is where we know it works. It's not a first-line medication for epilepsy. So, and this is because the studies were done in a drug-resistant epilepsy population. It wasn't studied as being a first-line medication. So we don't have the data to support that at this point. There is still research underway. One of the other key things to remember is that just like other medications, CBD has side effects. There are also other treatment possibilities for drug-resistant epilepsy. CBD is just one of them. So for some patients, epilepsy surgery might actually be curative for their epilepsy, and that may be a better option for them. Neuromodulation, VNS, RNS, CBS, those are options for some patients as well when they haven't responded to medications. Your doctor might recommend one of these other types of treatments before or after a CBD trial if you haven't responded to other anti-seizure medications already. And it really depends on the case. And this is something that's done and decided at a comprehensive epilepsy center typically. So some take-home points today. If other FDA-approved anti-seizure medications have not worked to control your seizures, you should ask your doctor if you may be a candidate for CBD. Remember that CBD does have side effects and can interact with other medications. So you should always discuss CBD with your doctors, even if it's obtained from a commercial dispensary rather than prescription CBD, because they may want to be monitoring blood work to check your liver, check the levels of your other medications. So always remember to tell them. And remember, there are multiple treatments for drug-resistant epilepsy. CBD is one of those, but potentially surgery or neuromodulation too. You should ask your doctor for a referral to an epilepsy center to discuss these options if your seizures are not controlled on medications. All right, I hope this talk was helpful for you as an introduction to medical cannabis and CBD. Thanks for listening.